Okay, I think we're just about ready to start here, Claire. I see people are just coming in, so welcome as you're coming in. I'm just going to introduce Claire and do some housekeeping, and then Claire will take the stage, hopefully. So Fáilte, or welcome in Irish, everybody to this webinar on ergonomics in special care dentistry, hosted by the Irish Society for Disability and Oral Health. It's our first series of webinars running through this winter, and we've received a huge amount of interest for the first one, which is always nice to see. And I suppose that speaks volumes on how our profession affects our bodies. So we're lucky and grateful to be joined by Clare Kelly, a physiotherapist who has lots of experience in this area. I do want to mention that this webinar is in no way a substitution for physiotherapy or any other form of therapy or medical device, but rather it's mainly for educational purposes. So I also want to say that there will be quite a bit of engagement here this evening, I hope, from you guys. So try to have some space around the area that you're watching this, and you won't need any gear except for the chair that you're sitting on, and some motivation as well. So just a few housekeeping rules here. So there's a Q&A box that you'll see at the bottom here, and you can ask questions throughout the talk. And other attendees are free to answer as well and share their perspectives on the questions. I'd highly also encourage you to engage with the chat function that you see in your menu. And just to kind of share, if you want to share your experiences about your history of musculoskeletal pain, or if you've noticed if you have any tips on managing them yourself. That would be helpful for everyone. And there will be a couple of polls throughout to encourage kind of interaction, and also give Claire an idea of your background, so she can tailor the exercises a little bit better towards your background and profession. And feel free to raise your hand at the end of the webinar if you want to share your thoughts vocally on a particular point. So all these kind of functions might be different depending on the device that you're using. So just familiarize yourself with those functions now. But back to our presenter this evening. So Claire is a senior physiotherapist who worked for 10 years in the HSE, the Health Service Executive, mainly in neurological and musculoskeletal rehab, and has kind of completed advanced training in vestibular rehabilitation as well. She completed a scholarship in Cancer Rehabilitation with PINC STEEL, and is the regional representative for Ireland. She's the owner of Pura Vida Physio and teaches Pilates and Yoga classes and the Next Steps group exercise program for cancer survivors online. She provides private one-to-one physiotherapy consultations for adults online and in clinic in Limerick, County Limerick. She also is a qualified Vinyasa and Yin Yoga instructor and leads wellness retreats for health professionals. So I will gladly hand the stage to you, Claire, as we look forward to hearing and seeing what your presentation.
Thank you so much, Amit. I'm just going to switch to the main mic now so you can hear me a little bit clearer. So it's an absolute pleasure to be invited to speak to you tonight on ergonomics. Amit's going to share the first screen now for us to get started. And as he explained, I am a physiotherapist, and I've done additional training in the area of cancer rehabilitation and in Pilates and Yoga as well. I'm quite passionate about movement, and I hope that that comes across this evening, and to be able to share that with you in terms of keeping you healthy and well in your own profession. Just moving on to the next slide. Yeah, and I have a particularly vested interest tonight, as my sister is a special care dentist and my other sister is a dental hygienist. So I'm very keen to keep my sisters and everybody that's attending here tonight as healthy and well as possible, so they have lovely, sustainable careers. Next slide. What is ergonomics? Ergonomics essentially is the science of designing the workplace and fitting the task with the capabilities and limitations of the worker in mind in order to improve your workplace safety, to improve performance and productivity. So to give me an idea tonight of those that have registered, if you could just let us know whether you're a dental student, whether you're a dental nurse, dental hygienist, a special care dentist, are you a carer, or just to give us an idea of the demographic of those that have registered for the event tonight. Great, thank you for your responses. Okay, fantastic. So really good representation from dentists and special care dentists tonight, and also dental nurses and dental hygienists. Excellent. So I know there's a few others as well. So my hope with the presentation tonight is that there's something that everyone can glean from this particular presentation. So looking at strategies that are relevant to us all. So next slide. So why do ergonomics matter? I mean, the prevalence of general musculoskeletal pain ranges from between 64 to 93% in dental personnel. And the most prevalent regions that were found in the research for dentists are back and neck pain. And the most prevalent regions for dental hygienists is the area of the hand and wrist. We're just going to take another poll at the start of tonight's practice to get an indication of whether you've experienced work-related musculoskeletal pain. It's important to note that this might include shoulder pain, it may include hip pain, although the research would suggest that back and neck appear to be the most prevalent areas. Okay. So my hope for this evening is to help to give you some education around strategies that can help to keep your joints a little bit healthier, and that may help to reduce that number. And for those that haven't experienced it, we can try and make sure that we're keeping you as healthy and well as possible in your job in order to prevent episodes of musculoskeletal pain. So next slide. And again, my reason for that is that I really strongly believe that as health professionals, you're really worth looking after. The job that you do is so important. The cohort that you look after are such a vulnerable cohort that it's so important that you're taking the same time and care for yourselves as you give to the others around you. Next slide. So I'm aware of some of the challenges that you can experience as oral healthcare professionals, that your job may include you being in static or awkward postures, or postures for prolonged periods of time, that your work can involve repetitive movements. It can involve quite high levels of stress, and that within special care dentistry, especially, that the patient cohorts you're seeing can be medically compromised. They may be presenting with behavioral issues that make positioning and management more challenging, or they may be presenting with reduced mobility, which makes it more difficult in terms of positioning as well. And in some cases, and I'm often very conscious of our colleagues as dental hygienists, that you may be working without the support of another person. So with that in mind, next slide. I want you to think about an ounce of prevention is worth a pound of cure. So there are strategies that we can use on a day-to-day basis to look at maintaining joint health and to help in terms of maintaining a good capacity for you to be able to sustain your work and reduce the incidence of pain. Especially to anyone who's new into this area of work, looking at establishing good practices early to help you to sustain a long career. So what helps us to maintain joint health? And I just want you to take a moment at the start of this webinar to just check in with yourself. And these are all areas that can really help you to keep your joints and body healthy. The first area is looking at getting sufficient physical activity during the week. And the recommendation, according to the American Heart Association, would be 150 minutes of moderate intensity exercise per week. We need 8 hours of sleep per night as adults in order to help us to be able to reduce the amount of inflammation in the body and to help our joints. And then hydration, the European Food Safety Authority would recommend for adults that we are drinking 2 litres of water per day for women and 2.5 litres of water per day for men. Hydration is especially important in terms of reducing muscle cramp. We need to be doing 2 to 3 days a week of strength training. And within that strength training, it should be targeting different areas, including our legs, our wrists, our shoulders, neck, back, and our abdominals. We should be stretching, and that doesn't have to be a long period, but have a daily stretching routine. And also incorporating diaphragmatic breathing or stress management techniques on a day-to-day basis. And we'll go into that a little bit later. Next slide. So I'm incredibly passionate about 3 planes of movement. I think it helps in terms of explaining musculoskeletal pain, and it can help you in terms of forging a path towards recovery. Our body is designed to move in 3 planes of movement. When we talk about the frontal plane, this is any movement where the body comes forward or where the body moves back, where the arms move forward, where the arms move back, or where the legs move forward or back. And typically in our professions as healthcare professionals, we tend to do an awful lot of movement through the frontal plane. Our other planes of movement are our sagittal plane of movement, which is any movement where the arms are moving away from the center of the body or where the legs are moving out away from the center of the body. If you consider within your work role, you may notice that there's certain planes of movement that you're more dominant in. Our last plane of movement is our transverse plane of movement. This is any movement where we are rotating. So either rotation of the neck, rotation of the trunk, rotation or outward rotation of the hips. And again, consider your job role, your day-to-day tasks, and think about which planes of movement are you most dominant for you. And then what we're aiming is to find a balance. So either through your work day, introducing other movements that bring you into those 2 opposite planes of movement, or outside of your work, so in your own hobbies, introducing more planes of movement that bring you away from that dominant plane of movement. And that can help in terms of prevention of injury, but it also can help in terms of recovery from injury as well. One of the primary areas for most of us as adults that tends to be more tight or restricted is rotation, which can have an impact in terms of our shoulder health specifically. Next slide. So why should I stretch daily? Essentially, it's to counteract common areas of tightness from dominant postures. So if I know that my work involves me being in the frontal plane an awful lot, where my arms are forward of my body, then I know that I may be more prone to tightness across the front of the chest. If my job involves a lot of sitting, I might be tight through the front of my hips. So I want to ensure that I am allowing those areas to move through their full range and to prevent any tightness occurring in the muscles, as muscle tightness can restrict the joint movement underneath, which can lead to stiffness and pain. And also by maintaining my flexibility, it allows me to be able to maintain the natural curves of my spine, which allows me to be able to safely transfer load. So if you find yourself in more awkward postures in work, that ability to be able to move your pelvis and hips more freely can allow you to transfer more load through the legs, which are designed to take it a little bit easier. It also feels good. So getting into the habit of stretching daily is a lovely way of moving lymph fluid around your body, which helps to support our immune system. And given that we are still navigating a global pandemic, anything that helps to support your immune system is worth doing on a daily basis. Next slide. So the first part that we're going to do today is we're going to start with a movement snack. This is one of my favorite stretches for shoulder and mid-back area. Now, if you are one that pressed in the poll that you had experienced musculoskeletal pain at the time, or you're currently experiencing it, I'm going to show you 2 variations of this stretch. If you know your shoulders are tight or you get pain in this area, you can start with your elbows in by your side. Take a breath in, and as you breathe out, draw your hands out to the side. This is one variation of an external rotation stretch. If it's comfortable for you to do so, you can link your hands and place them at the back of your head. If you know that one shoulder is either stiffer or tighter than the other, then you can start with one shoulder at a time. So take a breath into your belly, and as you breathe out, press your elbow back towards the wall behind you. This is a deep stretch for the capsule of your shoulder. It also helps to stretch into your mid-back area, and it can help to improve movement of the shoulder overhead. If it feels comfortable, you can take a breath in, and as you breathe out, the option to press both of the elbows back at the same time. As you press both elbows back to the wall or surface behind you, it's going to deepen the stretch that you feel between the shoulder blades, and you may feel the stretch across the front of the chest. Inhale in this lovely open position, and as you exhale, option to bend the elbows and to release the stretch. Again, taking the opportunity, if it's been a long day, if you've been sitting a lot, if you've been in front of the computer, this is a lovely chance to counteract that position. Breathe to your belly, and as you breathe out, press the elbows back. And then releasing the hands and relaxing the arms back down. This particular stretch can be practiced in sitting at your treatment chair. It can be practiced in standing. It can be practiced during your lunch break. It can be practiced lying in bed before you start your workday. Next slide. So ergonomic principles, we're going to go through these in a little bit more detail, but I've just put them up as a summary slide here so that you have it to refer to. Essentially, what we're aiming to do is to bring your joints into a neutral position, to ensure that you're working at a proper height for you, whether that's in seated or standing position, that you're alternating your posture and movements regularly, and that helps to minimize fatigue caused by staying in positions for long periods of time. Minimizing contact stress, which we'll come into later, and keeping materials within an easy reach for you. Again, it's to prevent you from overreaching. Leaving enough room for your feet, your knees, and your head when you're in a seated position, and using mechanical aids or transfer equipment to minimize lifting or to minimize patient handling. As we know from our manual handling training, keeping loads close to your body and avoiding excessive reaching. And that allows you to be able to use your stabilizing muscles of your body. When you're turning, just ensuring that you're moving from your feet and your hips rather than twisting through your upper body. And next slide. So positioning, there's another number of things to consider. The positioning that you take or your posture will determine which joints and which muscles are used. So the first thing we're going to go through in quite a lot of detail how to look at your posture and to get into a position that suits your body best. But it's also worth considering your patient's position and asking them to move when they can and in the circumstances where they can as well. I'm conscious that within, and especially in special care dentistry, that sometimes you'll find yourself in suboptimal scenarios. And in those scenarios, my main advice to you would be to take regular movement breaks, alternate your posture and alternate your movements in order to reduce the sustained period of it, which can help to reduce the impact of those suboptimal scenarios. If you know that you're working with clients with behavioral issues that might impact on positioning, it can be helpful to consider having a carer present who is aware of behavioral strategies that can help in terms of keeping them positioned or calm, and also aware of signs of escalation for your safety and theirs. And the other thing I would consider when it comes to positioning is whether the dental chair is the best place to treat this patient for you and for them. And we'll come to that later. Next slide. So individual considerations. When it comes to ergonomics, I want you to consider your posture from your work commute through your day and out the other side of the day. So thinking about how you get to work and whether that's in the car, whether it's cycling to work, whether it's walking to work, you have an opportunity, if you're driving to work, to start and get yourself into a lovely neutral position and be supported in that position in your car. So you're starting from a good reserve or capacity before your workday begins. And we're going to go through that neutral position shortly. Once you get into work, then the next thing is just ensuring that we are, when it comes to the equipment that we're wearing, that we're not creating any contact stress. And that can come in the form of the gloves that you're wearing. So we want to ensure that you're wearing the right size and fit glove for you. When you place your gloves on, you should be able to create an L shape with your hands, so from the thumb to the index finger. If there's any restriction or bunching in the web space between your thumb and index finger, it's an indication that your glove size is too small, and that can cause unnecessary pressure or compression on the neurovascular structures in your hand. So first things first, ensure your glove is the right fit for you. If the glove size is too big, you'll find yourself gripping within the glove itself in order to keep the glove on. And that again can cause unnecessary contact stress. In terms of your scrubs, we want to ensure that they're the correct fit for you and that they're not restricting any mobility or movement through your shoulders that would enable you to get into a neutral position at the shoulders and upper body. And we're going to go through a quick test for that I sometimes call the downward dog test. When you're at work, we want to ensure that you're in supportive footwear and just being mindful that the higher your heel, that impacts on the center of gravity and your balance within your positions, especially when we're in standing. So I would really encourage you to have supportive footwear with good grip. When you're aligning yourself up with the dental chair, just making sure that you have space for your feet, your knees, and your head in the seated position so that your lighting is moving around you and not the other way around. Move your feet or hips to turn, which we've spoken about. And then lighting and temperature in the room is really important for you, that we're watching that the temperature in the room isn't too cold, which can sometimes cause us to draw the shoulders up in a tense position, and ensuring that you have enough lighting to be able to see and have good visibility to complete your work, to avoid you overstraining through the neck in order to be able to see clearer. Your seating should be at the right height for you. And we're going to talk through that, but we want to ensure that the seating you have is adjustable and height adjustable for you, and that there is a tilting option for your hips. And when we talk about easy reach, if you imagine within arm's distance for you is your semicircle, any items that you use most often should be within easy reach within that semicircle. Next slide, please. My slides are paused at the moment. So we're coming to our scrubs test. So to check that your clothing is not restricting your movement, you come and have a stand up and come to the very back of your chair. And this is known as a standing downward dog test. It can be useful to help that your scrubs aren't limiting your shoulder movement, which is useful for your work and preventing compression in those areas, but also can be used as a counteractive stretch if you are involved in general anesthetic surgeries, long procedures, or if you've had high patient flow for the day. It's a lovely stretch to introduce between patients for the health of your back and shoulders. So to set yourself up, place the heels of your hands at the back of your chair and walk back until your elbows are straight, and allow your head and your chest to drop down towards the floor. Now, if you're feeling any pull at the back of the legs, you can bend the knees to release off your hamstrings. And it's going to help you to come down now into a deep stretch for the back of the shoulders and for your upper back. With the knees straight, you'll feel a big stretch through the back of the upper thighs into the hamstrings area as well. If you're in scrubs that are too tight for you, you won't be able to come into this position, and it's an indication that you may need to change the size of the scrubs that you're wearing. This particular movement, I would encourage on a regular basis through your day. It's a fabulous exercise to bring your back into a straighter position and counteract dominant flex positions during the day. Next slide, please. So now that we've stretched into your upper back, I want you to bring your attention to the position of your feet, okay? So as we are coming into a neutral position, the most important thing that we want to do is make sure that your feet are supported on the floor and that they're flat on the floor. They're your base of support, and they form a stable foundation for the rest of your spine. It's also important to consider, depending on the task that you're doing, whether it's in sitting or standing, your stance. So if your work or if the task that you're doing at the time requires more effort or strength, you may need to widen your stance, which will increase your base of support and make you more steady as you're carrying out more challenging or more effortful tasks. Next slide, please. So we're moving now to our neutral position. And the first basis of a neutral position is to have our feet flat on the floor. And what we're aiming when we come into a neutral position is to be able to have the natural curves of your lower back. So our spine is designed to have a gentle hollow at the lower back, a slight rounding through the upper back, and a gentle hollow at the neck. As you sit onto your work surface, we are aiming to tilt your pelvis to bring that hollow into your lower back and that hollow into the back of the neck. To assist you with that, the position of your hips to knees is important. If I'm sitting on a chair where my hips and knees are in line with each other, I need to move much further forward to help myself get into a neutral position. If, on the other hand, I'm sitting on a surface where my hips are higher than my knees, it takes less movement to come into my neutral position, and it's easier to stay there for longer positions. So when you have your feet flat on the floor, get your hips higher than your knees, and then we're going to be working on getting your pelvis into a neutral position. Your neutral position is to enable you to be able to take the weight of your spine through your sit bones. And I'm going to come a little bit closer so you can see the bones that I'm talking about. At the base of our pelvis, we have two larger sit bones that are designed to take our weight. So when we tilt into a neutral position, your weight is taken and borne through these larger bones that are attached to much bigger weight-bearing bones of our pelvis. When our back is in a rounded position, your weight is taken through the lower part of the sacrum and onto the tailbone, which is the equivalent of the size of your fingernail, taking the full weight of the upper body. So the tilt of your pelvis is in order to get your spine in a position that the load is taken through these larger sit bones and then down through the legs. That's in terms of our neutral position of the pelvis. Then we want to think about drawing our shoulders in line with our hips. So as we tilt the pelvis forwards, we're aiming to come into a position where your shoulders are directly in line with your hips and where the shoulder blades are drawing back and resting so that the front of the chest is in an open position. The neck should have a natural curve. So I'm watching that the head isn't forward of the body, that the chin is parallel to the floor, and that the back of my neck is longer than the space between my chin and chest. My head should be stacked on top of my spine so that the weight of my head is taken through the spine and down through my sit bones. Next slide, please. So a pelvic tilt forms the basis of your foundation in your posture in a seated position. It also can be used in a standing position as well. So where you're sitting at present, bring yourself to a higher surface. So if you're in a couch, you're going to have to work much harder to get into a neutral position. Bring yourself to a surface where your feet are flat and supported and the hips are slightly higher than your knees. Your hands can come onto your hip bone for support here, and visualize that tailbone, the very end of your spine. Tuck your tailbone between your legs and you'll notice the back comes into a C shape. Breastbone is dropping down towards the pubic bone. We are compressing and the spine is coming into a shorter position. If you stick your tailbone out behind you and tilt your pelvis forwards, you're now going to be coming into an exaggerated hollow of the lower back. We're lengthening up through the spine. And this is a movement that can be done in a seated position to help to reduce any stiffness or ache that you're feeling at the lower back, to alleviate pressure from the area of the tailbone, and to enable you to come forward into a neutral position to utilize the muscles of your abdominals and your lower back a little bit more. So that gentle rocking movement forwards and back is to help you to come to a position where you're then resting on your sit bones. If you want to check whether you've gotten yourself to a neutral position, you can place the palms of the hands underneath the body, resting on the buttocks. As you scoop your tailbone between your legs, when you tip your hip bones forward, you'll feel the sit bones in contact with the hands. And as you rock from side to side, you can feel the definite pressure of the sit bone through the hands. And that's how you know that you're upright and in your neutral position. Next slide, please. So We've brought the feet to a stable foundation. We've brought the lower back into its neutral position. Now we're thinking about the head. And your head position is crucial to reducing pain through the back of the neck, shoulders, and into the lower back. The average weight of an adult head is 5 kilograms. The further forward the head travels, the more pressure that is borne through the ligaments and muscles at the back of the neck, top of the shoulders, and down towards the lower back. When the head comes 3 inches forward of the spine, it is the equivalent of 42 pounds or 19 kilograms taken through the back of the neck, shoulders, and into the lower back. So considering that over the course of a day, if we're not adjusting regularly and checking in with our foundation and redistributing that weight through the body, that is going to lead itself to over sustained periods of time to a lot of pressure and unnecessary tension and pain through those areas. Next slide, please. So unfortunately, this is something that we see. In the picture on the left-hand side, we see a dental student where the feet are up and off the floor. And with the feet up and off the floor, it's much harder to keep yourself in a neutral position. So you tend to find yourself tucking your tailbone in and coming into that C shape or rounded lower back position. We also notice that on the side, on the left-hand side, the head is forward of the body now, so that load is being taken through the ligaments and muscles at the back of the shoulder. Similarly, we're seeing a similar position on the right-hand side of the lower back coming into a C-shaped position here, where the weight is being taken on the tailbone. Shoulders are forward of the hips in this position. The head is forward of the shoulders, and we're seeing areas that there would be a build-up of tension, tightness, and pain over the course of the day. Next slide, please. So how can you help this? Chin retractions are one of the best postural exercises that you can do to strengthen your deep neck flexors if you are aware that this is an area for you that is prone to either tightness, tension, or pain. This can be done in a seated or a standing position, and if this is something that rings a bell with you, then I really strongly recommend that you come into standing for this initially. Bring yourself back to the wall and let your heels, your bottom, and your shoulders rest back against the wall itself. And just noting, do the back of your shoulders make contact with the wall? Do your buttocks and back of the hips make contact with the wall? Do your heels? And then tucking your chin in. So you're gliding your head back between your shoulders and noticing, does the head come back as far as the wall? So this is an indication of the strength of your deep neck flexors, your main stabilizing muscles for the head and neck. This can be done in a seated position as well. So when you are at work, once you have the feet flat, hips higher than the knees, that neutral position of the lower back and the shoulders stacked over the hips, think about gliding the chin so that you're drawing the chin down to lengthen the back of the neck so that the chin is parallel to the floor, the eyes remain level, and you may feel some work through the front of the neck, which are those deeper neck flexors. This can be a really lovely option to practice between patients, to check in on where the position of your head is and then take a moment to take some gentle retractions. So you're helping to counteract that position or posture. Next slide, please. So anyone that knows me knows that I am like a broken record. And this is just a point just to remind yourself to relax your shoulders. So take the opportunity now to draw the shoulders up and relax the shoulders down. Next slide, please. So chest and upper back are often an area that if our arms are forward of our body when we're working, the chest can be an area that can get a little bit tight and the upper back is an area that can get a little bit tight. So these are really lovely stretches if you've had a lot of computer work in the day or to counteract between a day of outpatients, so back-to-back patients. It can be done in different ways. So the first level of the stretch is to place your hands back to the back of your chair and use the chair for support to draw the shoulders down away from your ears first and then draw your shoulders back. So the chest is up and lifted and you'll feel a squeeze between your shoulder blades as you stretch across the front of the chest and as you stretch into that mid or upper back area. Now, if that feels comfortable and you'd like to increase the stretch, then you have the option to Link the hands behind you and press your knuckles down towards the floor. This is going to deepen the stretch through the shoulders. It increases the stretch through the front of the chest and through the upper back. And again, this can be held for between 30 seconds or up to 5 breaths and be repeated regularly throughout your day. Next slide, please. So this ties in quite nicely with the last stretch that we've done, and it's known as a scapular squeeze. Our muscles at the back of our shoulder, or our shoulder blades, they are our primary stabilizing muscles for our shoulder, and they allow our arms to move up overhead without pain. So these are a set of muscles that are really worth checking in with throughout the day. By resting your hands on your lap and relaxing your shoulders down away from your ears, draw the shoulders back just as you did in the last exercise, but visualize like you're holding a little pencil between your shoulder blades. So squeezing and wrapping your shoulder blades around your spine. This helps to recruit those stabilizing muscles at the back of your shoulder and also stretches the front of the chest. This can be practiced regularly in sitting throughout your day. It can be practiced in standing, in the car at the traffic lights, and it can be practiced first thing in the morning before you get out of bed. Next slide, please. For those in the audience that are working in the area of dental hygiene, the dominant positions through this profession tend to be when the wrist is in a flexed position with the palm facing down. So it is important through your workday that you get the opportunity to be able to bend the wrist in the opposite direction, so into wrist extension with the palm facing up. Now, if you know that this is an area that feels a little bit tight or tense, the first version of this stretch would be to bend the fingers towards you. So you feel the stretch along the forearm. You can intensify the stretch by taking your hands to press the palm, pushing the fingers towards the face, or to increase the stretch further, you can straighten the elbow, relax your shoulders down away from your ears, and you'll feel the stretch along the wrist and up along the forearm itself. That stretch can be held for up to 30 seconds or the equivalent of 5 breaths and practiced on both sides. And again, strongly recommended to just integrate it throughout your working day. So you're counteracting the position that you tend to be in through your work and coming into counter stretch position. Next slide, please. So strength training, so far, the movement snacks that we have covered work towards flexibility predominantly. So that's having enough mobility to keep your joints in a neutral position. For capacity when it comes to challenging positions, we also need to have a reserve of strength, and reserve of strength predominantly through those deep neck flexors, through the stabilizing muscles at the back of our shoulder, our abdominals, our back muscles to keep us in that neutral position, and also sufficient strength through the legs to take the weight of our upper body through the course of the day. So it is recommended that we do 2 to 3 days a week of strength training, and ideally non-consecutive days. So you're allowing body recovery time between. If strength training is new to you, I would recommend that you be assessed so you can be started on an appropriate level for you. And to remember that muscle soreness is really normal and can persist for up to 48 hours after training if you're starting strength training for the first time. It's really important that your training should balance out those dominant movement patterns in your work. So I would strongly recommend that your strength training involves strength work for your wrists, your shoulder stabilizers, so your rotator cuff, and that you're involving some form of core stability work so that it allows you to be able to maintain those seated positions in a more upright position. And when you are doing any work in standing, so for example, for dental nurses or for dentists in surgical situations, that you are doing work that includes strength for your thighs and the back of the hips. This can come in lots of different forms. So it may be body weight training like Pilates or yoga. It may be including the use of free weights or resistance bands. But as I mentioned before, it should always include your core stabilizers and your rotator cuff, which are often an area that are neglected. Next slide, please. We're going to take a moment now. So when we've talked about getting into a neutral position, feet flat, hips higher than the knees, neutral position of the pelvis, shoulders down from the ears and setting the back of the shoulder blades and those chin retractions, they're all postural moments that you can take to help to set yourself up in a good position for work. The last area to be mindful of is your breathing pattern. Considering for your work day, if you are breathing up in your upper chest or apical breathing for 8 hours in your working day, this can cause an awful lot of unnecessary muscle tension around the neck and shoulder area. So take a moment now to place one hand on your belly and one over your chest or your breastbone. And if this is new to you, you can use a mirror in front for some visual feedback. Close your eyes, and it's sometimes a little bit easier then to tap in and feel, where does your breath move to when you inhale? So as you take a breath in, does your belly or your chest move? So which hand can you feel the breath move? As you inhale, do you feel your shoulders lift up? So if you're feeling a lot of movement through your chest and no movement of your belly, and if you can feel the shoulders rise up as you inhale, this is often referred to as apical breathing. It's a short and shallow breathing pattern where we recruit the muscles of our neck and shoulders to assist us with breathing. It's a less efficient method of breathing and can create a lot of unnecessary tension at the neck and shoulders. Diaphragmatic breathing, on the other hand, is where the belly moves and swells as we breathe in and hollows as we breathe out. Far more beneficial and efficient method of breathing, and it can help to reduce muscle tension at the neck and at the lower back. I've included as a resource after the references a free video on how to complete this as a technique that you can integrate on a daily basis. It can be done either through your workday or it can be done outside of your work if you've had a stressful day. It is important to remember that your breathing pattern has an impact on muscle tension and can lead to higher levels of fatigue. So your breathing is something to be mindful of through your workday as a resource for you to reduce muscle tension. Next slide, please. So we move again from our own body, so the ergonomics of your position now, into the instruments that you're using. So considering within your workspace that you have good visibility, and we've spoken already about lighting, but also the option to be able to use magnification or the use of dental loops. It is recommended through the literature that we're using good quality mouth mirrors that aren't scratched so that we're not compensating our head position for faulty instruments. In terms of minimizing contact stress, the research would recommend round-handled instruments compared to hexagonal handles to reduce any unnecessary compression through the hand itself. Silicone grips are recommended, and also the use of finger rests or the fulcrum finger technique has been proven to be beneficial. I've placed in brackets lightweight cordless handpieces with inbuilt lighting and automatic handpieces as well. I'm mindful that these may not necessarily be something that you have access to within your workplace, but they're also recommended within literature. Next slide, please. So when it comes to computer work, so if we're thinking in terms of report writing, or in the case of dental nurses through your workday, we really strongly recommend when it comes to computer work to take short breaks often. So the main message is to try and sit less and move more. 5 to 10 minute breaks every hour are proven to be more beneficial than 20 minutes every 2 hours. Sustained periods of computer work are very tough on the eyes and can lend itself to fatigue in that area and headaches. So we usually recommend 20-20-20. So every 20 minutes for 20 seconds, focus on an object that's 20 feet away, and it allows the eyes to be able to rest. As we've spoken about before, it is beneficial to alternate your tasks. So perhaps standing up to take a phone call, if you've got a scheduled meeting, perhaps taking that in a standing position, walking to the printer, getting up for water breaks. So allowing yourself the option to be able to alternate from sitting to standing. It can be useful to think or consider for a standing desk when it comes to writing up notes, just ensuring that it is at the correct level for you. So eyes should be level with the top third of the screen, and that's in either sitting or in a standing position. I'm mindful that for everyone that's attending tonight, everyone's slightly different height-wise. So if you find getting yourself eye level with the computer, or if you find when you're up in a seated position that the feet are raising slightly, you have the option to place a footstool underneath if the desk height is set. So if it's fixed and not adjustable, you can compensate by taking additional support underneath your feet in order to bring your eyes level with the computer screen, have your lower back in neutral, and to have your feet supported. And that's considered more optimal than having the feet up in space. It'll allow you to maintain that neutral position of the pelvis with greater ease. If you use x-rays, if you use PC or monitors or screens within your work on a daily basis, it's recommended that you have a VDU or a DSE, digital screen equipment assessment, done to help to ensure that you are aware of how to use it safely. And if you are using laptop for work usage, this isn't covered under a DSE assessment. So a risk assessment needs to be carried out for laptop that's used for work purposes. I would recommend that you use a laptop stand, as it's very difficult to achieve optimal ergonomics with the design of a laptop. So the laptop will need to be raised up to a higher height, so to allow your eyes to be level with the screen in a neutral position. And a separate mouse and keyboard is recommended to allow the wrists to be able to stay in a neutral position. If you are doing report writing for a long period of time, it can be useful to have a document folder either in front of the computer on a slanted board or to the side as demonstrated here. And I also would strongly recommend that you have regular eye tests. So when we're working with computers, often the impact of our eyes and having appropriate lenses, if required, can help to make a computer work more comfortable for you, reduce the incidence of headaches, and make it less likely to be straining by bringing your head forwards if you're finding it difficult to see the screen itself. And remembering that you can always bring the font size up to make it easier to visualize. Next slide, please. So minimizing patient handling. We want to try and avoid handling patients unless you're trained to do so. So it is useful to clarify your patient's transfer status before they come into surgery where possible. So establishing what the patient can do for you and asking them to move where they can. Patients who can walk the height of their dental chair can make it easier for them to transfer so that you don't need to bring your hands on. So using the principles of your ergonomics, where your hips are higher than your knees makes it easier to stand up. So if you've got someone who's frail or more elderly, but is still mobile, you might raise the dental chair when they are going to stand up off it, so that their feet are flat on the floor, their hips are a little bit higher, and that can often make the transition up into standing much easier for them. In relation to manual handling procedures associated with a client, risk assessing and planning manual handling procedures before the patient comes in, and ensuring that it's trained staff that are using transfer equipment. So in the case of clients that require transfer equipment, you may liaise with their carers or consider the option of a domiciliary or home visit where you have access to that transfer equipment and someone who's trained to use it. If you're working on medical wards, linking in with nursing staff to ensure that your optimal positioning of patient for treatment before you arrive, and remembering the use of your profiling beds on the wards so that you can alternate the height to suit you, that the breaks are allow the bed to be movable, so to allow you to be able to position yourself with sufficient space. In terms of special care dentistry, just considering the timing of your treatment for clients with movement disorders like Parkinson's disease, when they're going through an on period, so where their medication is working most optimally to allow their transfers to be more straightforward for you, and it can make it the treatment a little bit easier. Consider the design of your dental surgery, so mobile chairs, mobile suction, and mobile carts to enable treatment to be undertaken for someone within a wheelchair or on a stretcher. And wheelchair tippers or tilting features of a patient's own wheelchair can often allow them to come into a position that makes it easier for you to remain in a neutral position. Next slide, please. So I've just put up a few pictures of some of the transfer aids that I've spoken about there. So ceiling track hoist or mobile hoist, the wheelchair tipper, sliding sheets, which can often be used to help to position a client further up or to the side on the dental chair with a little bit more ease, and then transfer boards that are sometimes used by wheelchair users to get on and off the dental chair. Slide, please. So when to contact a physiotherapist, I would strongly recommend to really prehab. So if you noticed in any of the stretches that we were doing tonight, any areas of tightness or that felt difficult to attain, that might be an indication for you that it's a time to link in. So we can help to support you to establish an appropriate strengthening or flexibility program for you. If you've had a new gradual or sudden onset of pain, if you're experiencing pins and needles, tingling or numbness, or a sudden onset of weakness with reduced grip strength or reduced range of movement, these are all indications that you need to receive some assessment and treatment. Next slide, please. If that is something that's troubling you at the moment, just know that you have 2 routes of access for physiotherapy at present in Ireland. You can get a GP referral to your local health service primary care physio, and that service assessment and treatment is free of charge, or you have the option to go privately. And if you go to www.iscp.ie, you'll find the list of chartered physiotherapists by geographical region, but also by speciality in Ireland as well. There is a separate sub-clinical interest group as well that look at the area of occupational health and ergonomics, that if you wanted to arrange a VDU or VDU or DSE assessment, or a work capacity and conditioning assessment, this can be done by a physio from the CPOHE. Next slide, please. So what I offer, I teach 2 online classes, a Pilates class and a yoga class that are both clinically focused. The Pilates class would look at helping you to attain a neutral spine and then strengthening into the areas of your neck, your shoulder, your hip and back, encouraging mobility in those areas and also finding stability. For yoga, we tend to do more weight-bearing work, so it's helpful for strengthening into the wrists and shoulders, and includes guided breath work and relaxation. I also offer one-to-one clinical Pilates sessions. So if it is something that you want to work on an individualized basis specific to you, and private physiotherapy consultations if you would like to develop a strengthening program individualized to you, or if you're experiencing musculoskeletal pain at present. I support women to stay active during and after cancer treatment, and I'm delighted to say we'll be running another yoga and nutrition retreat in January in Loughrea in Galway. Next slide, please. These are the 2 resources that I mentioned, the diaphragmatic breathing technique video, which can be found on my YouTube channel, and also a guided body scan with autogenic relaxation, which is especially beneficial for reducing muscle tension. Next slide, please. These are the references for, and I just want to especially bring your attention to the FDI, who have brought out ergonomics and posture guidelines this year, and they're at the very top of the reference list there, and also their HSA, which are health and safety ergonomic guidelines as well. Slide, please. I want to take the opportunity to thank each one of you and for all the work that you've done on the front line during the very start of this pandemic, and for your continued work for this vulnerable cohort of patients and people in our society. I want to thank you from me and behalf of my family as well. And if I can be of any further support for you, these are my contact details, and please feel free to get in touch. If there's any more questions, I'm very happy to take them.
Claire, that was fantastic. That was incredible. I think I speak for everyone when.
So Ahmed, I'll take my mic off now, and that will make it easier for me to be able to hear you, I think.
Perfect. Can you hear us now?
Yeah, I can hear you perfectly.
Wonderful. That was I was just complimenting you enormously there.
Oh, thank you.
I was saying how thorough and broad-reaching the presentation was, and I think there's something to take from for every profession, you know, every oral healthcare profession that you mentioned. We have a couple of questions that have come in already. Specifically, there was one regarding the downward dog test. How high should the chair be when you are performing that test, Claire?
Yeah, and that's a really good question. So when we're doing that test, what we're aiming essentially is the equivalent as if I was in a downward dog position on the floor. And if you've never done yoga before, what we're aiming to do is to get your wrist, your elbow and shoulder in one straight line with each other. So the height of that, and usually the height of a standard chair will work, but if you're in a clinical setting where the chair is slightly lower than that, you can use a desk space and it'll work just as well. So counter level or workspace will work. You just need to step back further to get the legs a little bit straighter to come into that position. And the other thing I would say is bend your knees. Okay, so hamstring length will impact on this as a stretch. So if you're feeling a huge amount of strain through the back of the legs, you can isolate the shoulders alone by just bending the knees. If you want to bring it more hamstrings, you can straighten the legs. So height of it depends on the height of you and the surface you have available, but you can often do it
from a lower surface as well. I would usually say back of a standard chair, or if your dental chairs aren't as high as that within your office, I usually wouldn't use wheelchairs anyway for that one. You don't want it rolling away on you. Then you can use the desk space that's near you, and that's usually quite a nice height to come back from.
Wonderful. That's very much. Yeah, you've frequently alluded to to positions that are native and comfortable for you, rather than a standardized position, which I think is unique, because I've been to several physiotherapists who recommend, this is the way to do it for everyone.
And I think what I'm really conscious of, Ahmed, is we're all starting at a different shape and different level of flexibility. So I think if you can learn how your body moves, and I suppose part of what I'm saying on that as well is, when it comes to the reason so much of my presentation involved flexibility, is that you need to be able to stretch out these muscles to bring you towards that neutral position. If you are very tight in those areas, it's going to keep bringing you back down into positions where we've more load through your lower back, through your neck. So the reason I'm really saying, work on these little flexibility movements, these movement snacks, is it helps you to keep going towards a position where your load is taken more effectively through the body. But it is bearing in mind, none of us sit in a perfect posture all day long. Most of us don't. The key is the change of it. It's to alternate and allow those different movements more often throughout the day. And that, I suppose, I think is more manageable for most of us, and also a lot more sustainable as well.
I'm glad you said that, because it makes me feel more human now.
Yeah, and I really think that's something to bear in mind is, if you can just get those additional movements that you don't get a lot of in your day, and start just integrating more of that through your day, that cumulative effect of it is so beneficial.
I have another question here. Are there any tips for treating a patient in a wheelchair, specific or when the patient can't cope with being fully reclined?
Yeah. So, and this is where we're talking about those suboptimal scenarios. So this is where actually your capacity becomes a bigger factor in that scenario. So when I was talking about strength training, is I've worked with wheelchair populations for quite a considerable period of time. So the wheelchair tippers, I suppose, if there is it in terms, I suppose it depends on what the condition you're dealing with as well, because that can kind of influence things as well. But my general point of view would be on it is, you may not necessarily stay sitting for that scenario. I sometimes will come into standing positions where I work towards those same principles. So I've got, my feet flat on the floor, a nice wide base of support. I might be working towards my squat positions, and might have to bring up pressing my hips back, so I'm allowing myself to be able to pitch forward a little bit easier in those positions, and working predominantly my thighs, so my quads and the back of my hips in that scenario. And I might then stop and take a little movement break and stop and stretch and take my chest back stretch, and then come back and do a little bit more. So you might have a little bit more leeway to be able to do a little bit more in standing for those particular scenarios.
Perfect, thank you.
And again, that depends on the height of that particular individual as well. So you might find that actually seating, if you're smaller or if you're not as tall, that might be easier for you. Standing might be a better option. So it depends on the height of that particular individual. But I certainly wouldn't be afraid to come up into a standing position, nice wide base, press your bottom back, and allow your legs to take more of that work in that scenario.
Excellent. We have a question from a dental nurse who says that we often have to work to the height requirements of the dentist regarding the chairs, and as a result have to outstretch ourselves. Are there any tips?
So, and my sister was a dental nurse before she became a dental hygienist, and I know the one thing I would say, you have the benefit as a dental nurse that oftentimes you will be maybe note writing or being able to alternate your position a little bit more. I understand it's difficult when you've got a mismatch between the height of your dentist and the height of your dental nurse. Sometimes we can't always be at exactly the right level to each other. There is a lovely, it's alluded to in the FDI guidelines, so the ones that are referenced on the end of the references list here as well. So that's one that's worth looking at. But I also say to you, it might be a case of that you actually have to stand up a little bit more and take more movement breaks for yourself. So when you're getting something for the dentist to come back, take that as an opportunity for you to be able to stretch back and counteract the position that you have been in. So just integrate more movement snacks for you throughout your working day as well. And it may also be worth discussing with the dentist, is there a way for you to be able to get in a little bit closer so that you don't have to overreach as much? So it might be something that's worth communicating to them, and something that you're noticing in your work day.
Thank you. I'll take a couple more questions I think we have time for. There's a person here. I was looking for advice on positioning of patients during GA procedures specifically. Simon had a long 3-hour procedure to do 13 fillings and 2 extractions and a cleaning in a patient with special healthcare needs, and had a lot of back pain following this, understandably.
Yeah.
So
and so just like I was saying on the slide in terms of the GA procedures, when it comes to standing work for prolonged static positions, the pelvic tilt that we did in that seated position, where we were tilting the pelvis forward and back, when we're in a 3-hour procedure, you may find, first of all, I would say take periods of time where you can come back into that downward dog facing stretch, fabulous one for GA procedures, and to break up that period of time for yourself. Similar to computer strategies, you want to try and take small breaks where you can, okay, and where it's possible. The other thing I would say to you is a simple pelvic tilt in a standing position can make a massive difference to the discomfort that you feel through the lower back and to where you're placing your load. So when I'm in this standing position, if I have my tailbone tucked under, the equivalent of when I was sitting down in that C shape, if I draw my tailbone back towards the wall behind me, that's you coming into that natural curve of the lower back. So I would always say there's 2 pointers to watch for in standing positions when you're working. Are your buttocks gripping? If your buttocks are gripping, your tailbone is tucked under, you're in that flattened, posteriorly tilted position of your lower back, which means the lower back is taking your load. So when you are in a neutral position, the legs should be in a slightly straighter position, and you'll feel kind of a gentle hollow at your lower back, a slight kickback. The tailbone is drawn back towards the wall behind you. So in your GA position, what you may find is that as the surgery progresses, that the body gets tired and we start to tuck under a little bit more, that we're starting to grip into this area, and you just change the load to it going through your lower back rather than through your legs. That's an indication these guys need to get a little bit stronger, and that you would benefit from more hip and flexibility work just to allow you to be able to alternate that pelvic position through your surgeries.
Thank you. We have 2 more questions. Is it better to have your knees splayed or together when you're sitting?
So our quads, which are our main stabilizers, ideally we should have 2 fist distance between the knees. When the knees fall in towards the center, we're switching off the main stabilizers here. So I normally don't like to recommend to have the knees touching. Having said that, depending on the shape of your dental chair, you may need to have the feet wider to allow you to get in closer to keep a better position. That if you have the knees too far, say that there's compression from it, that can feel a little bit uncomfortable. So I would judge your feet distance according to you being able to get close enough to the dental chair to keep a lovely upright position for you, and then judge your knee distance from there. But as usual, or as a general rule of thumb, try and avoid that position. It causes an awful lot of tightness around the hip, and it's not great for the inner part of the knees. Okay.
And what are your opinions on dental loops and saddle chairs?
Oh my God, I'm a major fan of saddle chairs. I don't know if you noticed that it came in as one of the pictures on the presentation. So the benefit of saddle chairs, I suppose, is it keeps the knees apart. So if you're someone who likes to leg cross, particularly in terms of report writing, that tends to mean that you'll get tighter through one side because you're just weight shifting through one is short while the other one is long. So saddle chairs prevent you from crossing your legs, which can help you to keep more even weight through your pelvis while you're sitting. They also have a feature that allows the hips to be tilted a little bit slightly forward, which allows you then to stay in an upright position for longer periods of time with greater ease. And they can be height adjustable. So you can bring them up to a height that feels good for you, and then you can tilt the hip bones forward. So if you know, for example, that you're very stiff through your lower back and it's quite challenging to get your hip bones forwards, By having a tilt feature on the saddle chair that allows you to be able to stay up there a little bit easier and support you there, that's helpful. It also, you'll feel when you start to slump back into that seat position, because you'll feel the pressure on your tailbone. So it's often a nice little feedback tool as well. But I think it's important to remember, you can be on lots of chairs and still be in a seat position. So you also do need to think about actively moving yourself towards that neutral position, because it's that active movement that counts. The chairs are there just to support you to stay in that position with greater ease.
Perfect. And loops, I assume you're
loops, yes, because the same idea, anything that's going to help to improve your visibility means that you don't have to compensate with that forward head posture that we were talking about. So if I'm finding it difficult to be able to see what's in front of me, the natural temptation is to draw the head forwards to make up that distance. Whereas with the loops, you have to maintain a certain distance for them to work effectively anyway. So it's often a little bit easier to be able to keep yourself in a better position at the neck. So yeah, I'm a fan of them.
Wonderful. Other than that, we have just plenty of compliments and praise, and we have a few people actually who have attended your online courses, and they highly vouch for them. I suppose there's one comment I'd like to read from Rhiannon Jones here. Thank you, Claire. I found this so interesting and clinically relevant. I teach working positions to undergraduates in dentistry, and will take so many of your points to them next week. It's so important to start as you mean to go on, and why should your private life be affected by preventable musculoskeletal issues caused in your work life? Really great presentation.
Thank you. And 100%, I completely agree with you there. And I suppose that's one point of hope that I've gotten across, is that, you know, the things that we do outside of work can really help you to be stronger and more healthy within the workday and kind of improve your capacities. But so that's where those little movement snacks can be so helpful, to just start integrating early and doing on a regular basis, so that when you go home in the evening, that you feel that you have the energy to do things that you really enjoy doing too.
Yeah, thank you very much, Claire, and thank you for joining us this evening. The next episode of our winter webinar series will be on bruxism and clenching in our special care patient population and how we manage them. That'll be with Dr. Rua Al-Halali, and I'm looking forward to seeing many of you there. Don't forget as well that we have our summer conference in the summer of 2022. So I would highly encourage all of you to become members of the ISDH if you're not already, in order to avail of discounts and be informed when these webinars and summer conferences are available. So thank you everyone for coming, and thank you very much, Claire, for shedding a lot of light and prolonging our careers by several years, I would imagine. And I hope to see everyone here at the next winter webinar series. Thank you everyone for coming.
Thanks, Millie.
Bye, Claire.